wanted to, before we get started, just share a little bit with you about the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. The Ohio Center of Excellence for Behavioral Health Prevention and Promotion is a new organization in the state. We just turned on the lights in May of 2022, but really what we aspire to do is to become a center and a space where prevention professionals and people who are working in the prevention field and their organizations can connect with each other, create a space to learn and grow, embrace prevention science, and advance health equity. We could absolutely not do this and create this center without the work of our community partners. And our charge is to really shine light into the work that is happening in Ohio. There is so much good prevention happening in Ohio. And what we would like to do is to just take a minute today to highlight some of that work around the OHYES survey and create a space for practitioners to connect and talk about where their successes are in engaging with school districts, engaging with each other, and then utilizing data. And so the Ohio Center of Excellence for Behavioral Health Prevention and Promotion is truly an initiative that is community-led. So we have partners across the state who helped us come up with today's session, connect us with speakers and our panelists who are really doing a great job. But without further ado, I will turn it over to Tessa.
Thank you so much, Jen. I appreciate it. And good morning, everyone. Thank you so much for joining us today. As a reminder, our session is going to be recorded today, so don't feel like you have to, knock yourself out trying to take notes. These sessions will be available on the Center of Excellence's website. If we haven't had the opportunity to meet, I am Tessa Miracle. I'm a research scientist at the Pacific Institute for Research and Evaluation. And today I am supporting this initiative hosted by the Center of Excellence by offering some facilitation. We could not do this without our panelists, so we definitely want to take some time and thank Jessica, Eddie, and Trevor for spending your time with us and sharing your expertise and knowledge. The insights that you're going to share with us today are extremely valuable, and we thank you for your opportunity that you're providing for our participants to dive into some deep conversation with you in our breakout rooms. I don't want to take too much of your time today. I would like us to host some brief introductions. We would love to hear from each of our panelists and allow you to introduce yourselves as well as your experience with OHYES. So if I could start with Jessica, we'll go left to right on our screen.
Hi, everyone. I'm happy to be here. My name is Jessica Kickel. I work for the Ohio Department of Mental Health and Addiction Services within our prevention office, specifically serving as the OHYES school and community lead. I've been in this role for just over a year now. So I've been working with our schools and communities to implement the survey with their youth.
And I will go next. My name is Trevor. I serve as the superintendent of Heath City Schools, which is a small to medium-sized school district about 30 miles east of Columbus. I have worked with the OHYES survey in being fortunate enough to become pretty familiar with it near its onset. Our district started to use it around 2015, 2016, and we had a successful implementation at a time where the survey was still new in a lot of areas, and we were able to build support for the survey and then benefit from learning more about our student population. So we've been giving it for about 6 years, and every now and then I'm asked questions about how to increase its use in other districts. So again, I'm Trevor, superintendent of Heath.
Good afternoon, Neel here. I'm a prevention specialist with Impact Prevention, working in the southern part of the state in Lawrence and Sauter counties. I've been in prevention field since 2018. When I first came on, we was doing the OHYES survey in 3 school districts in Lawrence County and using that data in our youth-led prevention teams, as well as a prevention data committee for the adult coalition throughout the county. And I wanted to take on broadening and strengthening those relationships in other districts. So I made a pretty hefty goal that the whole county the following year would be on board. And it took a lot of relationship building. It took a lot of jumping through a lot of hurdles and just working different avenues. And so within the next year, we was successful with bringing the whole county on. And then this past year started spreading into Scioto County. So I'm here to share and lend some of my experiences in building those relationships for OHYES. Thanks for having me.
Wonderful. Thank you. It was so great to hear a little bit more about each one of you. To keep us moving today, I think what would be really helpful is an introduction to OHYES. Jessica has offered to provide us, a few slides, tell us a little bit about what it is, how it works, and a little bit more about the administration. So Jessica, I'd like to invite you to unmute and share a little bit of that now.
Thank you. So like Tessa said, if we just step back for a second and cover what the OHYES is. So OHYES stands for the Ohio Healthy Youth Environment Survey, and it's a youth survey that's designed to measure health risk behaviors and environmental factors that impact youth, specifically their health and safety and well-being factors. The survey collects information that schools and communities can use to access resources and to create healthier environments for our youth. And by implementing the survey, districts and schools allow students to voice the risks that they perceive to their health and wellness, as well as their sense of resiliency to live healthy lives. And to meet the needs of middle and high school students, school leaders and communities must first understand which issues their student populations face. And just a few things to overview the survey and how it works. It's completely free, free to administer, free to get your reports. It's voluntary, so schools and districts decide if it's right for their students. And it's web-based, so it's just taken in a web browser on a tablet or a Chromebook, that sort of thing. It's eligible for students in grades 7 through 12, and we administer during fall semester. So we are currently within that administration period, and that will go through the end of December, winter break time. We have 2 versions of our survey. There's one that has 110 questions, or you have the option to add on 10 more questions that ask about sexual related behaviors. Again, that's up to the school to decide what's appropriate for their students. It takes about 30 to 35 minutes for students to complete, so easily done within a class period. And then the following March, schools and districts have the opportunity to get their results and their reports based on how their students answered. And like I mentioned, we are currently in our fall 2022 administration period for the survey. So we are actively recruiting for the fall. So registration has been ongoing since July. We've had superintendents and principals sign up their schools and districts. And like I said, that is still ongoing. Superintendents and principals should have received some links in their inbox to do so. Our administration window is about to open. We're experiencing a slight IT delay, but we're expecting that to open up any day now. And we will be notifying schools when we are ready to go. And that will go through December. Our registration deadline's coming up in a couple months, right before Thanksgiving. And like I mentioned, our results will be ready next March.
Thank you, Jessica. I really appreciate this overview. I think we've, in my work, I've often heard about OHYES, but it's wonderful to hear more about the specifics. Trevor, we'd like to hear a little bit more from you about why a school district should participate and what participation is like in the county.
Yeah, absolutely. So one background note that I left out in my introduction was that I was a health and physical education teacher. And when I taught health in high school, we talked about the issues that are most relevant to students on a daily basis. And that's how I was able to build relevance to what we dealt with in class. A complete parallel to the information that we're collecting in the OHYES survey. We survey our 8th, 9th, and 11th graders in Heath, and it tells us a lot about our student population. Now, realistically, our administrators and our mental health professionals at the buildings can tell you a lot about our students without the survey, but they can tell you that on an action research type basis. They can't tell you that at scale. They can't understand exactly which problems and which challenges are plaguing our students and how many of them. And I think we benefit greatly from that information, but we also benefit by sharing that information with our partners so that those in the community that are providing resources and providing that one-on-one to kids have information about our kids and can help us meet challenges. Currently in Licking County, we have a couple organizations conducting a needs assessment countywide, and the OHYES survey is one of the primary pieces of data for us to learn about teens across the county. So there's a lot of relevance to the data. It isn't always easy. I'm really impressed, Eddie, that you were able to get every district in Lawrence County on board in 1 year. That is phenomenal. So it takes some conversations with principals and superintendents, and I'll be able to talk to you all a little bit more about that in the breakout rooms and then in our next session, but it's well worth it. And I think this is data that just helps us serve kids much better.
Thank you, Trevor. And that's such a natural segue to hear from Eddie. Eddie, I know you have experience in making that ask. Really, what's it like in those yes situations? You have some relationships that we've discussed before, and we'd love to hear from you how to how to make that ask.
Yeah, thanks. I think that's great insight from Trevor coming from the superintendent standpoint. You know, when I first started working with OHYES, my first option was just to start sending some emails out, making some connections. And as the title of today's panel was, you had to become more than just an email, because Trevor can speak to this more than anybody else. Superintendents get bombarded with emails on a daily basis, so much they had to vet their secretaries and be like, all right, you guys just put a stop to all the non-essentials and just send me some of the essential things. And so I learned early on that it was going to take more than just sending an email out. You know, we've gotten great support from OHYES and from Laura and Jessica and others of helping us with resources of how that the school districts can benefit. And so two things that was super helpful to me early on and continue as I broaden the work throughout Scioto County is the fact of, instead of an ask from me, I want to approach that as how it's going to benefit the school district. There's so much benefits that Trevor's going to speak to, Jessica's going to speak to, others in breakout sessions and beyond, of this actual data from your school, from your kids, from your community, from the countywide reports, from the Appalachian reports, comparing that to statewide, to where we can get actual evidence-based strategies to implement, to look at the needs. I mean, the first time that a superintendent got a hold of some of the data, they looked at it and was like, wow, I didn't realize my kids were going through this. I didn't realize that they had this much stress level, or this much disconnection, or social isolation, or such an early age of alcohol use or vaping use. And to where they was looking at trying to educate in high school, they realized, wow, we got to back up into 4th and 5th grade to get ahead of this. So just going to the school and saying, hey, this is going to be a valuable resource to you. You're going to be able to put together a team that's going to look at this, and it's going to be directed exactly to the needs of our students. And second of all, just being more than that email, I found that you just had to find a champion in each of those districts. So Trevor, some of those have really engaged superintendents like you, and you get direct buy-in from the top down. Some of those you don't get direct yes from the superintendent. So it may be a school counselor, it may be an administrator, it may be a teacher, it may be a teacher's aide. It's in some districts been a bus driver, a custodian's been my in. And then what I use is wearing a prevention specialist hat, is I try to conjoin different avenues and work different aspects to get in. And then once you get in that district, you get that champion, you get them to talk to the superintendent to get that buy-in, and then work those relationships. I'll talk more about that in the breakout sessions.
Well, thank you, Eddie. And when you talk about reaching those champions, I know that that's not always an easy road. So I know the answer isn't always a yes, and it's not always maybe it's a yes later on, but it's not always immediately a yes. What are some barriers you've experienced when making that ask?
Yeah, so Tessa, the joke around impact prevention, Haley started. She said, Eddie does not take no for an answer. So when a superintendent, a principal, someone says no, some people just take that as like that's a permanent no. But as we've learned from our experiences, a lot of times that's just situational. That's a situational no. That's a lack of understanding of how it's going to benefit no. That's a current board situation no. That's a current, hey, I'm new to this position. I'm not taking on anything else right now no. So I think we have to just step back and begin to see situations from their point of view. One thing that helped me a lot was learning a little bit more about the educational system, sitting down with county superintendents, sitting down with curriculum advisors and saying, all right, tell me about the education. Tell me about some of the language that is used. And when I started using different ESSA reports and different PBIS and SEL, and they're like, oh, this is our kind of language, instead of going in with prevention acronyms like the YCEF and the YLP and the LST, like I'm a gangster rapping, with these acronym soups. When we start getting down to their language, they start opening up and seeing that, hey, this is going to bridge between prevention, between education, because at the end of the day, they still have requirements that they had to meet. And if we can help them meet those requirements and we're going to benefit the children, it's a win-win for everybody.
Thank you, Eddie. And as we think of the needs of leadership in our school districts, I think, Trevor, your insight into how some of those external factors may be influencing decisions made by our leadership in schools. Can you share more about your insight there?
Yeah, I mentioned that we got started around 2016. And at that point in time, our county was exposed to this. We had a couple asks, both individually and then as a county group of superintendents, we're pretty close. And some of the districts at that time were still having a tough time either buying in themselves, or what was more common was getting buy-in from their boards and communities. So we have most of the county participating, not all, but then fast forward to now. And I will say that from 2020 on, the landscape has changed in a couple ways. One, COVID happened, and like it or not, it brought the schools kind of front and center into an arena that we weren't necessarily exposed to in the past, both with COVID and then with the death of George Floyd and the move towards diversity, and then the move away from diversity, education and professional development. The schools became immersed in a very politically charged arena, and we're still there. And I bring that up because now there may be some communities where it's even more difficult to achieve buy-in, because sometimes looking at social emotional health and data, that's resisted by communities. And they may be doing it for one reason or another. A lot of times it is politically motivated, and has little to do with what are the immediate needs of our student body and the future needs of our student body. But the reality is we're still here. There are currently bills that are on the floor of state Congress, both the state House and the state Senate, that deal with social emotional health. They deal with teaching controversial issues or not being allowed to teach controversial issues, not being allowed to provide professional development for diversity. And without going into a lot of that, that is the world that I live in. And that's the world my colleagues live in. And I was able to do a lot of front loading information with my board in 2015-16, educate the board, the parents, and the community on exactly why we felt that OHYES was important and why we needed that data to take better care of our kids. Then we also provided the opportunity with several contacts to parents for them to opt their kids out if they did not want to. We now give the survey on a pretty routine basis, but we've seen other districts that have not necessarily done that front loading work, and they find themselves then on roller skates after they try to implement. That was then, it's only going to be more difficult now. So, you know, from a prevention specialist standpoint, you may encounter resistance when talking to a superintendent or talking to a principal or a counselor who's hearing from their superintendent. I would just say, be aware that all of us as district leaders answer to boards of education. And while my board of education may be very educated on OES and supportive, it doesn't mean that everybody is. And at the end of the day, my board of education votes yes or no as to whether I have a job. So that is a dynamic that you have to navigate, while at the same time, like Eddie said, my administrative assistant does not forward one phone call to me from a vendor at all day. So there's many of them that call and many of them that email. So it is also hard. The relationship aspect that Eddie has talked about is critical to the education and growth with school administrators. I hope I didn't go off course too much there.
Not at all. We really appreciate sort of this holistic perspective that you guys have provided. So looking at this from the multiple facets that not only go into decision making, but how these data can be used, we have a better understanding of the barriers that exist to each community, but we will have some common threads amongst each other. We really want to spend just a few minutes discussing what can we do to overcome them. So Eddie, can we discuss for a moment ways to mitigate barriers from the community?
Yes. So, you know, as we look at this, at the end of the day, we all have a job, we all have a boss, you know, we all have someone governing over us. So I think so many times we look at things one-sided, and the more that we can see the other side of things and come together and work together. I just had lunch with a superintendent last week, and he's new in his position. He's getting great support currently from his board. But he said, Eddie, he said, what can I do to better serve my kids? And one thing I told him, I said, I think that you got to, you know, encourage your staff. And if your staff is encouraged, then they're going to better serve your students. And I say that to just a lot of times we get so laser focused in this is the way it's going to be. And, you know, Jessica, OHYES, Laura, all of them do a great job at kind of like giving us the guidelines and here's the structure of how things need to be. Things don't always work exactly in that structure. We had a school district that wasn't even in the database. And I go to the superintendent and she's like, yes, let's do this. This is like 2 months ago. She's like, let's get this going. And Jessica's like, hold on. It's not even in our database. So, you know, I have to then be that buffer. I've got to say, Ms. Superintendent, this is going to be awesome. This is going to be great. We're going to put this off for however long, and we're going to have to revisit this. But my position in that community partnership is working through those logistics, working through those barriers. Something that was extremely helpful to me early on was that I became a site coordinator along with the school personnel. So that has helped me be in part of the conversations, the correspondence. I know when they're registered. I know if there's a district that's behind in something. So there is some responsibilities from the superintendent, from the principal, from those site coordinators. And one barrier that you get is you're starting school, right? It's busy season. A lot of times you have turnover, you have new administrator, you have new superintendent, and just getting them up to speed and letting them know the benefit that the prior administration had used in that. Just continue to foster those relationships. And for me, just being real hands-on. You cannot expect a great success of OES from just behind a computer screen, just behind a email, just behind a phone call. Those all have their place and they're important, but just getting those face-to-face meetings, putting some skin in the game, meeting them where they're at. Everybody's schedule is different. So you can't just say, all right, Mr. Superintendent, I'm going to be there at 10 o'clock next week. No, you got to see, like, when are they available? What's the best time for them? How can I fit it to meet some of their needs as well? How can I bring something else to the table? How can I educate them on how they're going to use this data once they get a hold of it? That's a huge key, is not just, hey, we need you to take this survey and that's it, but what are we going to do with this survey? What are we going to do with this data? And we're in a unique place with prevention specialists to where we can look at other grants, other opportunities, and we can say, hey, if you participate in this, we can help you with this service. We can do some bottom and life skills. We can do some vaping prevention. And that's the big success in it, is when they identify there's mental health problems, there's vaping problems, there's underage drinking problems, then how can I, as a prevention specialist, bring something to the table and say, all right, now we need to partner in services to help out with this. So each community is going to look a little bit different. Those barriers are going to look a little bit different. My biggest piece of advice is to build those relationships that's going to last past those barriers. That's going to last past those difficult moments when there is a delay in administration and you have to wait another month. So I think just constantly adding to those relationships from the superintendent, the administration, down to those students, those counselors. I try to get in as many principals meetings as I can, as many counselors meetings as I can, and I want everybody to know the work that is happening. I think the more people that understand that, the more success we have.
Thank you, Eddie. I really appreciate the time that you took explaining the multiple layers that go into mitigating barriers. So really thinking of it from a complete and holistic viewpoint. You did mention one piece that made me think that it may be time to hear from Trevor when you talked about changing some of the language that we use. So recognizing that, I might be calling something an apple and you're calling it a golden delicious, and we're talking about the same fruit, but it doesn't mean that we're calling it the same name. Trevor, we'd love to hear from you about how can prevention specialists connect better with schools? And then, how to make that easier, what schools can do to make it easier.
Well, I think, Eddie kind of described a lot of individual things that are just making the prevention specialists a resource to the school, help us to understand outside of our school. So I know how we use the data, but help us to understand, how do you use the data? When it was first introduced to me, I knew that the data were needed by some organizations for grant writing, to be able to write a grant to provide support. Individually, we work with an agency in the community that provides LSWs to us in our schools at a fraction of the cost of what we would have to pay, and those are supported by funds outside both organizations. And that's important, that we are able to provide data to those organizations that need it. Additionally, we need to be able to provide data to other outside organizations in the community that provide support in a number of different ways, whether it's providing food, whether it's providing resources for exercise or resources for parent support. We need to be able to team to work with those. So to point out to school officials, who are you working with? Because a lot of times, even as a superintendent, I have no idea the amount of support that we benefit from in Licking County. So help us to connect the dots. In Ohio, the support network is not standardized. So there's not a county agency that is serving every county. There's, quite frankly, multiple nonprofits that operate very differently from each other and in different ways. So just to try, if you're talking to a superintendent, keep it pretty basic, because we have 1,000 responsibilities and many of us are not smart about any one thing. We just have intermediate knowledge at best, and the multiple things that we work on. Secondly, when you're working at the building level, have a lot of respect for how this is going to affect their time. During COVID, I actually considered not giving the survey. And the reason that I considered not giving the survey is because we had students missing 10 to 20 days of school per year. they were quarantined or they were isolated because they were sick with COVID. And we were just struggling to be able to provide enough instructional time to float kids along. So to then go to my principals who are barely staffing their building to keep them open, even though I'm making them keep them open with, 3 or 4 classrooms that don't have a teacher. And then to say, don't forget, we're going to give OHYES in October. I said that with some fear. And one of our counselors is on here and she's probably laughing right now because she knows who I'm talking about. But time is a precious resource. So to also go in, I would just say yes, hi, Tara. To also just say, how, we may not know, where can we fit this? How can I do it? It takes 30 to 35 minutes. I would recommend not suggesting doing it in a specific subject or course, because people come to me a lot and say, hey, just give this in your English classes and it'll be good. Immediately I'm defensive. You have no idea where our English needs are or how many kids take English in 9th grade compared to 10th grade. It's actually all of them. But, if you say to give it in health in a district of our size that gives health in multiple different grades, wherever a kid can fit it in, not necessarily all to 9th graders or 10th graders, just, provide suggestions. If they say, where am I going to fit this? You might want to respond with, where do you have the highest concentrated area of students? And then, is it a testable area? Is it an area that you can spare some instructional time? Hey, it's 35 minutes, it's not 50. So just to be able to provide as much detail as you possibly can to them without trying to tell them you're going to dictate their schedule. Our principals who are running a building schedule and our counselors, that is a stressful undertaking to both build that schedule and then navigate it on a daily basis. I will say the school experience is a little more normal than it was in the last 2 years. It's not normal yet because nobody's used to what normal used to be. So just to be able to provide that feedback and those suggestions. But the biggest thing still goes back to what Eddie opened with, is building that meaningful relationship. OHYES came to me, but there was a contact that I had that was actually my dissertation chair at the time. Dr. F was also on this session. And that's how I learned about it and figured it was relevant, because I had somebody that I knew and respected that told me it was, so a lot of times you're not going to get in contact with the superintendent, and it's probably not the best use of your time. But find that counselor or that principal or that assistant principal or that teacher who you have a relationship or a connection with, and work your way in, because again, an email is just not going to get it done.
Thank you so much for sharing that perspective. And I appreciate, the recognition of, we all have day-to-day struggles within our work. And sometimes it's challenging to know, what somebody in another position is dealing with on the day-to-day. So thank you for being so candid and so open with what your experience is. We want to thank our panelists for answering my questions this morning. Thank you so much for being open. But now for our participants, we want to afford you the opportunity to ask any of those more in-depth questions, maybe just to have a more in-depth conversation with our panelists. So I am about to open up a few breakout rooms for you today. So we have 3 breakout rooms. So in room number 1, we will hear, you will have the opportunity to meet with Jessica, really learn about those existing resources to support community members and schools in decision-making, and learn more about OHYES implementation. In room number 2, we'll have Dr. Thomas, really able to provide those tips for engaging with school leadership and asking that question, like, how do I really gain support? How, that opportunity to just kind of be more honest and more connected in that way. And then in room number 3, we have Eddie, and Eddie is going to allow us to discuss successful strategies to build supportive relationships and really answer that question, how do I become more than just an email as I'm connecting with people that maybe I haven't had the opportunity to work with before.
As we are assembling back into our main room to wrap up our last 2 minutes of our very first prevention exchange, I want to thank all of you on the call for joining us today. Just a couple of housekeeping announcements. We are going to drop the link to today's evaluation in the chat. So if you want to take a minute and tell us what you thought, we would be grateful. We're again still trying to figure out the format and what works for this type of engagement. So we are, with that being said, the facilitation team, the Center of Excellence, we love suggestions. We want to hear from you and build a prevention exchange forum that you want to participate in. So please send us an email, send us a note on our website if you have an idea. The link to our website's there. Also want to remind you to sign up to receive monthly newsletters for the center using that QR code. You can scan it. It's the only way to get newsletters from the Center of Excellence. We want to respect your privacy. Finally, I just wanted to thank you and let you know that our next prevention exchange session will be Thursday, October 27th. And we are working to bring you a great session that focuses on medication safety as a form of prevention, knowing that October is Medication Safety Month. Tessa, is there anything you wanted to add about that?
Thank you very much for joining us today. If you did register using today's link, you are automatically registered for all future sessions. So we hope that you'll be able to join us in October. As always, we are open to your feedback on your evaluation. There is a question if there's a topic that you think would be a great asset to our forum. We invite you to share that with us. And as always, I want to thank you for your time. I know that you have many opportunities as ways to spend your energy and your time. And I just want to thank you for choosing to spend your afternoon with us today. I hope you have a wonderful day, and please don't hesitate to reach out if you have any questions. I did drop that evaluation link in the chat. You will receive a follow-up email with the evaluation, as well as where to find this recording. So Jessica dropped her email in the chat as well. So if you have any questions for Jessica, feel free to reach out. But as always, have a great day and stay safe.